Okay, thanks for watching. We're going to cover the rest of the topics of therapy. Previously in class, we already discussed psychoanalysis, psychodynamic therapy, behavior therapy, humanist therapy, and cognitive therapy. So next, let's consider cognitive behavior therapy, which sounds like just a combination of cognitive and behavior therapy, and it sort of is, although we would say it's an integrated therapy. In other words, uh, we make an effort to blend these two things together in such a way that it's most effective. So, in cognitive behavior therapy, the therapist works to help the person alter their cognitions, how they process information and think about things. That's the cognitive part, and also helps them to learn new ways of behaving, to engage in new actions, or to decrease maladaptive behaviors. So that's the behavior part. As an example, in applying this to social anxiety disorder, which we learned about in the last chapter in psychological disorders, where the person has intense fear of appearing in front of other people where they might see them make a mistake or look foolish. Let's say that this person, social anxiety disorder, is a student and they're faced with making class presentations. Now, normally the person with social anxiety disorder will do one of two things when it's time to make a presentation. Either they will show up but become so nervous in giving the presentation that they're not able to really effectively do it, although that's not so common. More commonly, they'll simply avoid that and just not show up when it's their time to make the presentation. So to help that person, we'll work with them in terms of altering their thinking about appearing in front of a group. So we might ask them things like, well, let's say you do get up there and you do begin to perspire or you do make a mistake. So what are people going to do to you? Well, they're not going to do anything to me, I guess. So I mean, are they not going to hurt you? No, no, no. I've never seen that happen. Well, are they going to like throw tomatoes at you? Well, no, they don't really do that in class anymore. Well, how about you? Well, so what are you concerned? Well, they might think something bad about me. Yeah, well, maybe they might, but well, if they're just thinking something bad, you're not even going to know, right? Yeah, that's true. Well, maybe they'd say something bad about me. Yeah, how much difference is that going to make 5 years from now or 10 years down the road that someone made a comment about your presentation? No, not really so much. Okay, well, what if I get a bad grade? Well, if you prepare well, you're going to get a decent grade. Okay, and provided that you overcome your anxiety about it, which you're going to do, totally confident of that, you're going to do okay. Okay, so we work with them in terms of their thoughts, and then meanwhile, while we're doing that, while they're helping them practice a new way of thinking about the situation, then we also have them to learn a new behavior and practice a new behavior. In this case, what we have them do is to create a presentation and then to simply practice giving that presentation alone at first until they're comfortable. Then practice giving it to their favorite pet or stuffed animal, so kind of low stakes, right? And so once they're comfortable with that, then practice giving that presentation to a supportive friend or relative. And then once they're again comfortable with that level, we move on to the next most difficult level, several supportive people. And when they're comfortable with that, then we add a person who's uh, unknown to them, a stranger to the group. When they're then comfortable with that, and they've done that successfully, we add a couple more people that they're not familiar with until eventually, as we increase the unfamiliar the people in the group, they're able to actually give that presentation to a group of people that they're not completely familiar with. So it's a gradual process. It does take time. It's very much like the systematic desensitization that we talked about when we talked about behavior therapy, but the combination of that as well as practicing new ways of thinking is almost always effective in helping that student overcome their fear of presenting something in front of others, and they're able to give that presentation with just normal levels of anxiety that everybody tends to have. So there's an example of how that might be used. Many other examples are possible as well. Now, next we'll kind of shift to ways that that therapy can be delivered. And so far, we've kind of considered how it can be done in an individual setting, but it's also possible to deliver almost every kind of therapy in a group setting. So, group therapy is very useful. The therapist can help more people, it's more cost effective, and there are benefits that are unique to group therapy that one doesn't get from individual therapy. For example, in group therapy, one might find that, oh, I'm not the only one that has this kind of problem. I don't feel so alone, so isolated. And in group therapy, one might also find that what they have to contribute actually helps others in the group. They might learn from how others in the group are coping with that problem. So, learning from the other group members, they might find that in that group, they have the opportunity to really be heard from by other people in terms of their concerns. And they might also find that in that group, they find a sense of belonging where they haven't experienced that elsewhere. So, in many cases, group therapy can be very beneficial. And in my estimation, it's one of the best ways of presenting therapy. Now, that said, people with severe problems may also require individual therapy, focusing on individual aspects of that problem. We also have family therapy, and family therapy then looks at the family as a system. So, in family therapy, the goal is not to figure out who's the problem, but rather how can they look at how that system is working, how the various parts of that family are interacting with each other, and then looking for dysfunctional patterns of interaction. The family members can adjust those patterns of interaction to help their family function more effectively. In many cases, this also boils down to improving the relationship between some family members or increasing communication within the family. Evidence-based treatment has become a very important concept in psychotherapy today. We want to base our choices of treatment to the person's problem, to the person that needs the treatment. No one type of therapy is the best type of therapy overall. It depends upon what kind of person we have and what sort of problem they're experiencing. For example, if you have a person who likes to talk a lot, yeah, maybe if psychoanalysis was still offered, that might work well for there. But psychodynamic therapy, the person has to participate quite a bit, or humanist therapy, a lot of talking involved on the part of the client there. So that might work well for that sort of person. But if you're a person that doesn't really like to talk much, and maybe a person who's not really much interested in feelings and emotion, well, in that case, person-centered therapy, client-centered therapy might not work well for you because it requires you to consider your emotional responses and to do quite a bit of talking on your own. In addition, research has indicated that certain types of therapy are effective for certain types of problems, and in some cases, not for others. As an example, as you see on the chart here, if a person is depressed, they have found that in general, behavior therapy or cognitive therapy or interpersonal therapy is most likely to be effective. By the way, interpersonal therapy is where they work on the person's relationships, either improving relationships that they have or maybe establishing new relationships that help the person come to grips with things. If the person has a phobia, though, generally speaking, they found that only behavior therapy really is effective. So it just depends upon the type of problem as well. Having said that, they found that therapies that are to some degree successful tend to have certain things in common with one another. Each of these therapies, uh, the therapeutic alliance, the relationship between the therapist and client or patient is important. So that relationship where the client knows that the therapist has their best interests in mind, that they really care about them, that someone is interested in helping them, and that there's someone that they can rely on and trust to help them with those problems. That in itself is very beneficial. Also, successful therapies give the person a new perspective on the problem that they're experiencing. So, a new way of looking at it. A lot of people that are depressed, they may think to themselves, well, I'm just, kind of weak, or, I'm just kind of not very good at facing life. But when they get a new perspective, that can be helpful. As an example, if they go to a psychiatrist who prescribes medication, the psychiatrist may tell them, well, you have simply an imbalance, a chemical imbalance in your brain, and we can correct that just like correcting any other physical thing. And so, no, there's really nothing wrong with you. So the person now says, oh, okay, it's just like having some other kind of thing, and like diabetes or something. And, it's not that I'm mentally weak. Or if they go to um, a behavior therapist, that behavior therapist may look at what are you doing all day? You're not doing anything. You're interacting with other people? No. So, we're going to get you to interact with other people more, and you're going to find that a lot more rewarding, and you're going to find that you don't feel so depressed. And the person says, oh, that's really what's been getting me depressed. Yeah, it's not that it's my own fault, I just need to learn some new ways of doing things, and so on. So a new perspective helps a person. Also, successful therapies give the person hope. So the person is told, you know what, there's something to be done about your problem. It's not a hopeless situation. And that kind of ties in also to expectations of improvement. So the person is led to expect that they're going to get better, and to some extent, that may have a placebo or expectancy effect, and improvement becomes a self fulfilling prophecy. And in fact, you may see the effects of hope and expectation and improvement even in a physical sense. Maybe you've gone to the doctor because you hurt yourself, you get some kind of ache or pain, or maybe you come down with some kind of flu or something like that. And so you're sitting in the doctor's waiting room, and as you're sitting there, a lot of people have the experience of thinking to themselves, hey, I don't feel quite as bad as I did a little while ago. Gosh, maybe I don't even really need to go see the doctor. So often people feel a lot better when they just know that help is on the way. And that sort of comes into play with therapy as well, when they know uh, that there's a likelihood that there's it's going to be helping them. Let's just quickly have a look at some of the types of therapists and what sort of training they would receive. First of all, we have clinical psychologists who are trained in providing psychotherapy as well as diagnosing psychological disorders. In this case, at least for now in Texas, one has to have a PhD in clinical psychology and then pass licensing exams. We also have clinical and psychiatric social workers having a master's in social work. Many of these social workers are also trained to do various forms of psychotherapy and are able to do so in addition to connecting people with psychiatric problems with appropriate services. We also have then a variety of types of counselors. And these counselors may be trained to do various types of therapy, particularly for certain populations, certain groups of people, or in certain situations. So we have, for example, marriage and family counselors, we have pastoral counselors, school counselors, or chemical dependency counselors, each practicing to help people within that area of difficulties. We also have psychiatrists practicing therapy as well. Now, these are physicians, medical doctors specializing in the treatment of psychological disorders. Not all of them offer psychotherapy, but many do, in addition to prescribing medications or physical treatments for psychological disorder. Now we're going to shift to having a look at a variety of biomedical therapies. And these are treatments for psychological disorder that focus on the physical aspects of these problems. So these are going to be physical, medicinal treatments, such as drug therapies, brain stimulation therapies, or psychosurgery. So let's start with considering drug therapies. This is also known as psychopharmacology. That's a fancy word for drug therapy for psychological difficulties. The first antipsychotic drugs were produced in the 1950s. And as you can see on this chart, those antipsychotic drugs were able to relieve the most severe symptoms of psychiatric disorders like schizophrenia and so forth, to the extent that many people improved to the point where they could be released from mental hospitals. And so, what followed very shortly after the introduction of these drugs was a decline in the population in mental hospitals. And as you can see, by the year 2000, only a very small fraction of people were now housed in mental hospitals as compared to the 1950s. Now, this also related to a phenomenon that has been labeled deinstitutionalization. And this is deinstitutionalization, releasing mental patients from the hospitals. This was possible, again, due to the invention of antipsychotic drugs that relieve symptoms, at least sufficiently enough that people could go back to live in their community with their families. However, as patients were released from these hospitals, in many cases, they were ill prepared to cope with society. They may have been there for long periods of time and were not familiar with how to interact in the community. Part of the idea of deinstitutionalization was that person who was released from the mental hospital would be able to get what treatment they needed at community mental health centers. And these were to be offered in each community, where the person could get the medications that they needed, possibly some psychotherapy if needed, and also be connected with services they might need, such as housing or things like that. In many communities, however, these were not sufficiently funded. They might be understaffed, not having the resources people need, or they were located in places that the patients could not access them, couldn't get to them. And so what we had is many people not actually receiving the services that they needed once they were put back into the community. So, not receiving the services they needed, especially if they had no family to return to, many of these people became homeless. They didn't have job skills for gainful employment, and because they weren't receiving treatment for their difficulties, they might behave in bizarre sorts of ways and so on. And so many of them also ended up, rather than mental institutions, rather ended up in correctional institutions, having done something that violated the law. So some people actually said, well, this actually amounted to more like trans institutionalization and transferring them from mental hospitals into correctional facilities instead. Now, having said that, in cases where community mental health centers functioned well and people could access them, and where people were assisted in getting skills for gainful employment or able to remain with family and so forth, many of these people did do better when released from those mental institutions. But we also have the downside of people not receiving treatment. And we're still actually seeing the effects of this even today. When you look at um, some of the mass homicides. In fact, most of them, what you find is a majority of these people actually did have psychological problems that were not being effectively treated. So we need to make sure in the future that our mental health services in the community are adequate and that people can get the treatment we need, because right now that's really working against us in our society. Now, having a look at the effectiveness of psychiatric medications, those first psychiatric medications seem to be amazing in their effects, but in fact, their effectiveness was at first overestimated, in part because the phenomenon of spontaneous recovery. Even people with severe mental disorders sometimes improve over time, seemingly out of the blue spontaneously, and that was not taken into account, sometimes mistaken for the effects of medication. And also, placebo effects were not considered, the influence of expectations on behavior as well. That said, more recent double-blind studies that control for these effects have shown that several types of drugs are indeed useful in treating psychological disorders. So we're going to look at some of them. Um, People suffering from schizophrenia, in general, if they can find the right antipsychotic medication and the right dosage, there can be significant improvement in their symptoms. So when you see somebody showing full-blown symptoms of schizophrenia, it's quite likely that there's a person that could be helped with the right medication. They're probably not on that medication at that point. We also can look at anti-anxiety drugs such as Xanax, Ativan. These drugs work by depressing the central nervous system and binding with GABA receptors, neurons, to reduce anxiety. Those traditional anti-anxiety drugs have some downsides. People develop a tolerance to the medication, so over time they require higher dosages, and also will develop a dependency on those drugs if they take them regularly for any length of time, so that in fact, if they discontinue the drug abruptly, they often will have a rebound of their symptoms, actually worse anxiety than they had before. In addition, traditional anti-anxiety drugs when combined with alcohol, can be very dangerous, can result in overdoses. So there are some downsides to these traditional drugs. So it's recommended that people use these only as briefly as possible. There is some experimentation now with some non-narcotic anti-anxiety drugs. One example is one called D-cycloserine, which is now being studied, potentially may be able to enhance exposure therapy or be helpful in treating PTSD. So we'll be looking at that. Maybe in the future, even better anti-anxiety drugs will be invented. Next, we have a look at antidepressant drugs, and the most commonly used ones today are the selective serotonin reuptake inhibitors, the SSRIs. These work by blocking the reuptake of serotonin so that there is more serotonin within the synapse between neurons, more active serotonin, if you will. So these then are based on the neurotransmitter theory of depression, that it is a chemical phenomenon. When we look at the actual effectiveness of antidepressant drugs, what we find is that they are about equally effective to our best psychotherapies for depression. So they're no more effective than therapy. Also, what we find is patients who are given medication only and not provided psychotherapy are more likely to relapse into their depression than patients who are also provided psychotherapy. And even patients who are given psychotherapy alone, what they find is that the benefits of the therapy last well beyond the time of the therapy, whereas the antidepressant drug only works so long as the person continues to take it. So the antidepressant drug, the patient must stay on a maintenance dose. Antidepressant drugs also have a number of side effects. The SSRIs, the more recently invented ones, have fewer side effects than previous ones, but even there, for example, sexual dysfunction is one of the side effects that is frequently encountered, and so for some people this may be a concern. When looking at the effectiveness of antidepressant drugs, other studies have also indicated that exercise has shown to be equally effective for people who are mildly to moderately depressed as taking an antidepressant. Now, having said that, if you know somebody that's depressed, please ask them to get in touch with a professional to evaluate the situation. Please don't just say, well, just get some exercise and you'll be fine. We need somebody to really evaluate how severe that depression is and what the best course of action is. Now, having said all of that, a number of researchers today suggest that antidepressant drugs really not as effective as the pharmaceutical companies would lead us to believe. In fact, Irving Kirsch, using data that was obtained through Freedom of Information Act, data that was not released to the public by pharmaceutical companies, eventually concluded in analyzing that data that antidepressants were probably more of an enhanced placebo. In other words, that when the people felt the side effects of the drug, that signaled to them that the drug was working, and then expectations led them to actually experience improvement in their depression. So there's some questioning and some very high level questioning as to are these really as effective as the drug companies would lead us to believe. Having said all that, if you take an antidepressant or if you know someone that does, please don't just decide that you're just going to throw it out. If you discontinue these without professional guidance, there are some very unpleasant things that can happen. So anyone that is considering discontinuing an antidepressant should work with their doctor to do so, and only under the doctor's permission. And again, simply discontinuing that without replacing it with other positive types of therapy is likely to be ineffective and dangerous. So please take note of that. Don't simply decide to throw these out if you or someone else is taking them. Another type of medications is mood stabilizing medication. This is to reduce the symptoms of mania in bipolar disorder. The traditional treatment, lithium carbonate, reduced the incidence of manic episodes in bipolar patients by 70%. That said, levels of lithium carbonate have to be monitored carefully in the person taking it. Today also they've found that some anticonvulsant medications help people to avoid manic episodes. Anticonvulsants are drugs that are traditionally used to treat epilepsy, seizures. So there's some new research in that area. Having talked about psychopharmacology, let's move to the topic of brain stimulation therapies. The most widely known brain stimulation therapy is electroconvulsive therapy. And this was devised in the early 1900s. It has kind of a sad history, if you will. This was a treatment that was abused, misused in the early days of the 1900s. In many cases, this was used to threaten patients in mental institutions to get them to comply. Very powerful currents of electricity were passed through the person's brain in many cases, causing brain damage. So this sort of has a frightening history. Having said that, electroconvulsive therapy as practiced today is safe and can be very effective for a particular condition. So it's a much different thing today than it was years ago. So just what is it? Well, this is a therapy that may be offered to a severely depressed patient, and in fact is only appropriate for severe depression. And this is a last resort kind of treatment. All other types of treatment have been tried, and the person is so severely depressed still that they may be offered this. The patient then, in choosing to go in for electroconvulsive therapy, is put under anesthesia. There is a muscle relaxant given to the person to prevent seizures through the procedure. And then an electrical current is passed through one half of the brain, and a much milder current than was previously used years ago. This treatment is safe. They monitor all the person's vital signs throughout this. And the biggest side effects that people today experience would be some memory loss of events from the few days before getting the treatment. ECT as practiced today is 80% effective in relieving severe depression. So very effective. They don't know the exact mechanisms of this. There's some ideas about it. But in fact, it may require additional treatments in the future. The person receiving treatment may find it effective for a number of months or maybe even years, and then may need to receive it again. For some people, though, this is the only effective treatment. Their severe depression continued with everything else. Some of these patients will tell you if it hadn't been for ECT, they simply would have killed themselves. So when you look at it that way, even though it seems like an intense sort of treatment, in fact, it can be a lifesaver for some. There are types of brain stimulation therapies being developed. And again, a lot of these for problems with depression, such as a type of therapy that stimulates the vagal nerve, relieving depression, or other types of deep brain stimulation where electrodes are implanted deep within the brain to relieve depression or relieve compulsions in obsessive compulsive disorder. One of the brain stimulation treatments that is also being studied right now seems to be very promising. It's called repetitive transcranial magnetic stimulation, RTMS. This is a therapy where a pulsating magnetic field is produced over an area of the prefrontal cortex of the brain. And this seems to have similar ability to relieve depression, similar to ECT, but without producing memory loss, convulsions. So far, the most severe side effects of this reported seem to be maybe a mild headache for a few hours after the treatment. So this looks very promising. Someday may replace ECT. Moving on to psychosurgery. This is a procedure in which brain tissue is removed or destroyed in an attempt to relieve a psychological problem. This has been attempted even in Neolithic times. In the early 20th century, psychosurgery was practiced in the form of the frontal lobotomy. This was a procedure where an ice pick-like instrument was inserted through the eye socket and was inserted into the brain, rubbing it back and forth in a particular way to destroy the connections between the emotional centers of the brain and the thinking centers of the brain. Was it effective? Um, in some ways, all too effective. In many cases, the person receiving the lobotomy, they were found to be no longer violent, yes, but they also had no motivation to do anything. Or that person who was overly emotional, yes, the emotionality was relieved, but to the point where they now had no emotions and just simply sat there all day. In many other cases, other types of brain damage occurred that also was severe. So this was not a very good treatment, but sad to say, was given to thousands of mental patients in a time where they were housed in mental institutions that were overcrowded and understaffed. So these types of treatments have been discontinued. Today, the methods of psychosurgery have improved greatly. It is used very sparingly. So today, when psychosurgery is used, it is a treatment of last resort. Everything else has been tried, it's been ineffective. However, even in that case, they first have to locate the malfunctioning brain tissue. And sometimes they can't figure out just where that is. Even if they can, they also have to verify that they can remove that brain tissue or destroy it without damaging other important brain structures. So, it doesn't make sense to do psychosurgery that relieves a person's compulsions in obsessive compulsion disorder if we're going to make them blind or deaf to do it. So, this limits how frequently it can be practiced. And of course, it's always also considered an experimental treatment today. So many other things have to be in place for the person to receive it. That said, there has been some very successful use of psychosurgery, for example, in relieving the compulsions of obsessive compulsive disorder. Now we're going to shift to the potential of maybe preventing or ameliorating psychological disorder. And so one approach is through practice of therapeutic lifestyle change. We know that psychotherapy can actually change the way the brain functions. That can be shown in PET scans. So, if the way that we think can change how the brain is functioning, it's no stretch to think that maybe if we change what we're doing in our body, that can also influence how our mind is functioning. So, one of the insights that modern research has received is looking at groups that lived as our ancestors did, hunter gatherer groups. And in those groups, they found that psychological disorders like depression pretty rare. And so they started looking at their lifestyles to try to figure out what elements of their lifestyle might be protecting them from psychological disorders like depression. And here's some things that seem to be coming out of that. These people get regular exercise as part of their lifestyle. Also, they get a certain amount of sun exposure, and they have very deep social connections. People in these groups often live their entire lives in a clan of anywhere from a dozen to 40 people, and so they're very closely connected with those people in their group. They also get sufficient sleep as they don't have modern conveniences. When it gets dark, well, what else is there to do? Well, actually, there is other things. They find that, yeah, these people often do after dark have celebrations and they stop to enjoy life together. That also contributes to the social connections. And in terms of their nutrition, much different than our modern American diet. Primarily, their diet made up of naturally grazing animals and fish, and then fruits, vegetables. So very different from our modern American diet. And they also have engaging work. Their work is their life and their survival and is meaningful to them for that reason. So we may be able to pick up on these things and include these in our daily lifestyle as best as we can. We might find that this is going to prevent or decrease the severity of psychological disorder. Another way of looking at prevention is to look at the bigger societal picture. So, we also may be able to prevent psychological disorders by attacking factors that contribute to mental health problems, societal problems like poverty and unemployment, prejudice, discrimination. If we can knock these things down, we're going to see fewer people suffering from psychological disorders. And also, if we help people improve relationships within their family, personal relationships within their community, we also are going to see less psychological disorder. If we can ensure that everybody has the opportunities, again, less psychological disorders are going to result. So there's many things we can do. It's going to take a lot of effort on our part, though, to attack some of these societal problems. So there you go. There's the remainder of the topics on psychological disorders, and so you can include that in your study of the topic. Thanks. Bye bye.